The closing of White's Ferry in December of 2020 created new health challenges for Up-County residents. With only one medical practice in the area, the community was already a healthcare desert. Without the ferry, many lost access to their primary care physicians, who practiced across the river in Leesburg. What had been a less than 10-minute ride to Virginia became an hour-and-a-half drive to the other side of the Potomac. And for one family, life hung in the balance.
I could have passed away because of the extra time that it took. I probably would have still needed a transplant, but how like precarious it was would have been very different.
Like today, I got there super early and thought, okay, they're going to get me in.
Watching the Paksimas family at home now, you could hardly guess how their lives have changed since White's Ferry closed down. Sharon Paksimas' health crisis began on a work trip in the fall of 2022. A senior education director for the World Bank, he traveled to Pakistan to check on local schools after devastating floods.
During that month that I was there, I contracted E. coli and hepatitis A. And I had thought that, oh, this is just a case of bad, food poisoning or something. And, but it was getting worse.
Paksimas' primary physician practiced in Leesburg, on the other side of the shuttered ferry. So he called on the only family practice in Poolesville, but they weren't accepting new patients.
And so we did what our family has been doing for the last few years, is we use the urgent care as our primary health care, because they're the only ones that we can get into and see on a regular basis. And they're not. They're not designed to be primary health care.
And I don't know if it was a less experienced doctor or what, but basically just said, yeah, let's watch it and see how it goes. It's probably just a bad, case of food poisoning. And they sent me home.
And they followed up with 2 telehealth visits, which I think they completely missed. The jaundice, things that I think you would have seen in person.
While we were still waiting for the labs to come back, that I just really went downhill. And it was so bad that, Sarah felt like she needed to take me to the ER. My situation was so dire that they actually life-flighted me from Shady Grove over there. That was extra time that could have actually put my life in danger even further.
Doctors at Georgetown Hospital determined Paksimas was in acute liver failure and in need of a transplant. He received his new liver in December of 2022. The long bed rest following the transplant affected the nerves in his arms and hands.
Bactrim that we still need,
And
Plavix.
Yeah.
Still on the mend, Sharam takes dozens of medications to alleviate some of the side effects of his medical ordeal. Sarah helps manage the complicated recovery process, and he practices small motor skills for his hands.
How's school?
It was good.
Yeah? Do you see I'm making progress on my coloring?
Yeah.
In spite of it all, the Paksimas still feel life in Poolesville has its rewards, but they also share some cautionary words for neighbors.
I couldn't rely on emergency transport getting here quickly. I think is something that people in this part of the county have to weigh those options. I think it contributes to our health outcomes.
If I were to have it to do all over again, I'd do it, But what we're trying to do is figure out how we can take what was designed as a pretty incredible place and make it even that much better. We like to call it a gem. But just because that's the case doesn't mean that it just should be forgotten completely.